Thanks for joining us on Creating Dementia Solutions. I'm Richard Pyatt. This is a Miles for Memories program. And all you have to do is follow Miles for Memories on Facebook, and you'll be alerted when these new episodes are deployed, or you can see us right here on Access Vision. Happy to have you with us today. If you've been following our episodes of late, you'll know we've been focused on the caregiver and thinking about things from their perspective. The idea that a caregiver has questions, concerns, and might need help. And we're talking about that again today. Want to introduce you to Suzanne Azuela. She's a registered nurse and a nurse educator with Home Care Transitions here in Battle Creek. Suzanne, welcome.
Welcome. Thank you for having me.
What does a nurse educator do, by the way?
Well, a nurse educator makes sure that the caregivers are trained, that they're capable to go out into the homes and do the care that they need to do, that they are educated on the tasks, that they understand what their client needs, and that's where I come in.
Yeah, so this is a significant role that you play, and you've done so for a while, haven't you?
Yeah, I used to teach. I was taught nursing at KCC, and so our company is really upright about that. They want the clients to get the best care, and so we have monthly meetings, and we have the certified PCA class, and that's where they learn how to do everything for the client in home, bathing, dressing, grooming, taking care of the dementia patient as they decline. So families, when they want to age in place, they call us. Their family member is getting sick, they're declining, and they want help from professionals in the community.
Absolutely.
So they call us, excuse me, and they ask us for help to support usually the family members that are doing everything they can. So we do an evaluation of what their needs are. We look at the client, how they're aging, what their needs are, what their abilities are and their disabilities. And then we do an intake. We let them know what we can do for them. We look at their financial. We look at the assistance that is needing, the level of care, nursing, caregiving, companion care, hands-on, and sometimes the client cannot pay for it. So we refer them to other agencies like the Medicaid waiver that can come in and evaluate them. As they age, they might be nursing home eligible and they don't have the money. And so the waiver can come in and do an assessment and pay for their care.
So there's, I think, about 16 things you said there that a caregiver is really concerned about. And so you can imagine in that kind of a situation that a caregiver is concerned about all those things. But there was one thing you said that was particularly interesting to me, or perhaps stood out, and that is the idea that you make sure that the folks whom a caregiver might meet from home care transitions, for example, are trained well, and they know exactly what to do. So you talked about an intake, but a family seeking help with a loved one who has dementia is something that you see regularly. And what do they usually do? Do they just call you and say, I think I need help?
They do. Usually they've done as much as they can, and then the client is declining and having issues they can't handle. And they need professionals. They want professionals. They want people they can trust, people that know how to take care of that person, that they're going to be safe. Because families want to keep their person at home. People want to age in place at home. They don't want to go to a nursing home anymore. And so they look at us, and we look at the care, and we also work with other professionals in the community to support them. And so, they call us, and we do an intake, we assess their diagnosis, we talk with their doctor, we talk to other professionals, and then we give them a plan of care that we can do. If they work with the waiver, if they work with the veterans can also help them if they were a veteran, and we will refer to the appropriate agencies to give them the care that they need.
I presume that sometimes when you meet someone who's called you and you're just getting to know them, a caregiver, for example, there's a sense of stress or trepidation about taking this step sometimes, isn't there?
They are. They need to trust who they're talking to, and they need to know that that person, their caregiver, is going to be safe with their person. They're going to be that extra set of eyes. And we have nurses. We write care plans. We go out and do supervisory visits. We check on the clients. And in the training that we give the caregivers, they're trained to understand changes of condition. Everything is person-centered planning with home care. And it's individual. Every patient isn't the same. Every dementia patient isn't the same. So that caregiver, we match our caregiver with the client so that family knows that they have that person that's best fit for their loved one.
Okay, that's
Yes.
good to know.
Yes.
Yeah, and they're concerned about the level of qualifications, the training, but also they should be concerned about, I guess, what you'd call a personality connection.
Exactly, and you're exactly right. We weren't going to put a chatty Cathy in with somebody that wants to be quiet and sit and read a book, and we do that. We evaluate the caregiver, we evaluate the client, and we put them together to meet the best needs. With the training, they learn how to assess the decline with the dementia patient. So it's not like a regular home care person. They have special needs that they're trained. In the monthly meetings that we have, in the certified class that we have, and then we are overseeing everything that they do. We go into the home, we go in and watch them do their work, so we know they're doing the right thing. So it's certified. They're not just told something and sent out to the home.
Sure.
They're evaluated all the time, and we constantly update the care plan to meet the client's needs.
So that's interesting. That's something else you said that piqued my interest. Care plan. So this isn't just an introduction and someone comes and helps. This is a vision that you've created for the patient.
It is. It's exactly right. And we're all nurses. The nurses do the assessment, and then we do the care plan according to their needs, and it's pretty specific. They might need assistance with dressing, bathing, feeding, transportation to a physician, and then the caregiver also is trained to report change of condition. Change of condition is important because people get sick, and you don't want to wait a week if they have a urinary tract infection. So they report anything they see that's abnormal. That alerts us to do a visit and to update the care plan, and then we contact the professionals in the community that we work with to help that family go through the changes and go on that road to recovery.
Boy, that's interesting, because when you said change in condition, when you're thinking about someone with dementia, you immediately go to a spot where you're thinking, the dementia condition has changed. You just brought up something interesting, the idea that there could be another health issue that presents itself. And so they're watching for all that.
Exactly, and a normal person, that with a normal mentation could tell you that, but a dementia patient doesn't. They can't tell if their foot is getting infected, or they have the urinary tract infection, or if they're getting sick. And we do all that training. We do monthly training and evaluation all the time. We want the patient to be safe. We want them to have a quality of care and constant supervision so that they're getting the best care.
And these are things that a caregiver would be concerned about in bringing someone else in as part of a care team to help.
Can I add something to that?
Yeah.
When the caregiver is trained and they have education, it helps us to retain them. It gives them more satisfaction. They like what they do, they feel confident, and they present themselves to the families and the client, and it's a better team. It's a better team when they have better education and they know what they're doing in there.
Sure.
They know what to expect, and they know they have backup like myself and the other nurses.
Well, this is a whole other show I think we could probably do on what it takes to do this kind of work. Boy, we could probably do a few shows just talking about those things, but it doesn't go unnoticed.
Yes.
Well, is it important to seek assistance like this sooner than later?
Oh, yes. You betcha. The earlier you establish a foundation of support with the family and the client, the better the response is. Dementia causes a lot of distrust, confusion, misunderstanding with the client. And as they age, it's harder and harder for them to accept care coming in. They want to know the family's there, they want to be in their home. And if you introduce a caregiver early and they get to trust that person, and then they get a routine, because change is so upsetting to a person with dementia. Anything that changes, a routine when they take their bath. So we want to keep as much the same, introduce them early so they trust that person, because the family members, they go on vacation, they work, they leave. Sometimes we just go in there as a companion or stay all night and maybe the husband just needs to sleep.
Right.
And so that client gets to establish a foundation with that secondary caregiver, and there's a trust there.
Boy, it's
And
so
it helps the
important.
family.
Yeah.
Yes.
And that person feels comfortable knowing them as well, the caregiver.
Yes,
I mean.
exactly.
Yeah.
Exactly.
So speaking of that, you talked about, which is really interesting, the idea that someone could come and offer respite overnight.
Yes.
What kind of respite is available for folks?
Well, as I said, we do companion, we do overnight, and then Mary Birch is a daycare.
Yeah.
It's a wonderful daycare for dementia patients, and they're there Monday through Friday. They're open 8 to 4. They have wonderful skilled therapy and rehab. They have great meals. They have activities. And again, they're based on the client's abilities and their interest. And they're not forced to do anything. So each person is treated individually. I've been there, I've seen it, I've supported it. They have transportation. They can get the patient there.
Yeah.
And as well as we can help with transportation. And again, it's another support system
Sure.
for the family.
And that's offers an opportunity for someone to get out of the house. as well.
Exactly.
Interaction with others.
Exactly.
Yeah. And of course, as you pointed out, respite is available in the home as well. And is that pretty common? I would say it probably is.
Well, it's getting more common.
Yeah.
Dementia, they're estimating almost 6 million people with dementia, and it's growing.
Yes.
And so, yeah, we're getting calls all the time for families that need respite. They need care. They need. We have people that just need 4 hours to go out and get their hair done, the wife, and they just want a companion to stay with their loved one so that they're safe. They don't want them wandering off. They don't want them falling.
Right.
And maybe fix them a lunch and chat with them, play a game, whatever they need. And so, and staying all night, that one person that's taking care of them may just need an overnight visit so they can get up and be refreshed and take care of their loved one. And so we do that. We can toilet the person. We can sit by them, make sure they're safe all night. It's a good service so that families can stay at home.
Wow.
And
That's
it saves
incredible.
government money too by home care.
Sure. Right.
Yes.
So someone who's a caregiver maybe is contemplating the notion of reaching out for help to your organization or just in general. Is there anything that you might recommend to them that they be sure they ask about? Or maybe there's something that you wish they asked more often?
Well, we do a complete intake assessment when they call. So everything is, we ask questions, assessment. What do you need? What does the family need? Where's the client at? We do a complete, thorough assessment. And we make suggestions of things that they're not thinking about.
Right.
What about, their medications? What about their allergies? What about certain things that we need to know in case of an emergency? We take emergency contacts. We try to cover all the bases so that family member can be comfortable that they can leave and we are in charge and we're going to be safe and we're going to contact them if there's any problems.
All right, so this is the kind of standard that's out there.
Yes.
And if you're a caregiver caring for someone with dementia or they're a loved one, maybe you're not directly caring for them, but you're concerned about them, these are the kinds of things that you can ask and you can hear about and you can avail yourself of, which is tremendously important
It is.
because the support will eventually be needed.
Exactly.
Yeah.
And we're there to help.
Well, Suzanne, thank you very much for this conversation. It's
Thank
good
you
to
for
know
having me.
that
Thank
these
you.
things are available. Suzanne Azuela is a registered nurse and nurse educator with Home Care Transitions in Battle Creek. Creating Dementia Solutions is our program, a Miles for Memories program. By the way, we encourage you to check out the Miles for Memories technology that's out there. the safe return program and help home programs are tremendous, and the details are at MilesForMemories.org, and we invite you to check those out and maybe purchase some of those really critical pieces of equipment that can be so helpful. I'm Richard Pyatt. Thanks for being with us.